All right, hey everybody. Dr. Kyle Loveless here with Queen City Health Center and The Wellness Way. Hey, we're gonna do an awesome video for you today on eczema. Ultimately, eczema is a lot of people think of it as a skin issue, but what I want you to learn today is to look at it from a different viewpoint, okay? So we're gonna shift your thinking today, or shift your health by starting to shift the way we think. Many times when we see skin issues, we wanna get lotions, we wanna get creams, and all we wanna do is get rid of the skin issue, but the truth is there's a whole lot more to it. Okay, so that's what we're going to spend time going through today. And now the goal of today is that by the end of this, you truly understand, or start to understand at least, a different way of looking at eczema. This is actually one of the biggest health issues right now, is a lot of skin problems. Every day we're seeing more and more people come in with whether it's eczema, whether it's psoriasis, and these are even babies coming in with eczema. That even haven't had like a lot of vaccines, or that had they're breastfeeding, they're seemingly doing all the right stuff, but still having issues with the eczema. And so you're gonna hopefully understand by the time we get done today why that is, okay? So starting out, I really wanna start out just kind of looking at the normal, or what the medical community would say eczema is, and what causes it, and then what the treatments for that are. So what is eczema? Okay, eczema, ultimately, it's an atopic condition, atopic dermatitis, a condition that makes your skin red and itchy. It's common in children, but can occur also in adults. Atopic dermatitis is long-lasting and tends to flare periodically. It may be accompanied by asthma or hay fever. So this is an immune response. You're seeing something like asthma, which is an immune response, hay fever, which is an immune response. And so we know as you go through this, you're gonna learn that this is an immune response. But ultimately, they're just saying it's atopic, and ultimately they don't really know what's causing it, okay? And we really don't know how to get rid of it other than just to treat the symptoms, okay? So that's kind of the medical approach, and it's really the viewpoint of how they look at most things really, is if there's a symptom, they're looking at the skin and trying to figure out what the skin's doing, instead of saying, okay, there's gotta be an underlying cause to this, which typically is what happens with skin. And we're gonna go through some research today to help you see how the stress response, right? Emotional stress, physical stress, chemical stress, how that actually affects our skin. And so a lot of our skin issues, again, are going to be more digestive problems or stress-related issues. So prevention, this is, again, the Mayo Clinic, the prevention concept, okay? So this is how you prevent eczema. None of this really makes a lot of sense to me, but I think that what they're saying is this is how you prevent the feeling of eczema, which is the skin issue part of it. Moisture your skin at least twice a day. Creams, ointments, and lotions, seals in moisture. Choose products that work well for you. Using petroleum jelly on your baby's skin may help develop atopic dermatitis. Do you see how the philosophy and the approach is just way off? Putting petroleum on your baby's skin, are you kidding me? That sounds like the unhealthiest thing you could ever do. And to think of this as a prevention for something, the truth is that's gonna affect the liver, that's gonna affect digestion, the immune response, everything, by putting petroleum on that child, and will actually make eczema worse. It might feel better because it's more moist, and most of these creams and lotions are gonna have a ton of chemicals in them, and you're gonna find out that this is really almost a chemical issue in the first place. So try to identify and avoid triggers that worsen the condition. That makes sense, cool. Take shorter baths or showers. Now, one of the things it does say, infant children may experience flares from eating certain foods. All right, so now we're getting somewhere that they've acknowledged that there's certain foods that can actually cause this to flare up. It says eggs, milk, soy, and wheat. So if you or your child has eczema, just go ahead and get rid of those. That's an easy one. Talk with your child. I say easy. It's an easy decision. It's actually doing it on a daily basis is a little bit harder. Talk with your child's doctor about identifying potential food allergies. Okay, this is the Mayo Clinic. I've had people say that food allergies don't exist. They're telling you right here, and they are probably just talking about IgE responses, but this is also an IgG response, which is your immune system responding to proteins in the bloodstream, okay? Take shorter baths or showers, limit dryness. This one's insane. Take a bleach bath. I mean, come on. The American Academy of Dermatology recommends considering a bleach bath to help prevent flare-ups. Bleach is super toxic to our body. And so just the fact that they're saying that, in my opinion, anything they say after that, I'm not gonna listen to, because that's such a bad statement, it's not even funny. So, but that's the prevention process here on Mayo Clinic. Okay, Mayo Clinic, what treatments should we use? It can be persistent. So they use medications. Their first line of approach is going to be that medication route. They got medicine, they have surgery. Medications are going to be your steroidal creams that help control itching. And they're ultimately getting rid of that immune response. A steroid is going to help, or cortisone is going to help lower inflammation, which is your immune response. Drugs to fight infections are part of that. Oral drugs that control inflammation, newer options for severe eczema. FDA has recently approved a new injectable biologic called Dupilumab, Dupixent, whatever. It is used to treat people with severe disease who do not respond well to other treatment options. This is a newer medication, so it doesn't have a long track record in terms of how it will help or how safe it is. Studies have shown to be safe if used as directed. Okay, well, here, I'll tell you this. If you have eczema, the first step is you want to find out why. You don't want to just start treating it with steroids and things that suppress your body's natural immune response. Therapies. Wet dressing, an effective intensive treatment for severe atopic dermatitis, involves wrapping the affected area with topical corticosteroids. Again, that's going to block your immune response and cause other health issues. Light therapy, that's a great option. Light therapy is actually a really good option because that will help. It helps you at a cellular level, at a mitochondrial level, and it helps kill off any bad bacteria or any infectious stuff that might happen. This is actually a really good approach in terms of helping the symptom, which is what you're seeing on your skin. Okay, so eczema really, in my opinion, based on what I've learned and reading the research, is going to be more of a symptom. The skin part is a symptom of an underlying cause. And that's what we want to talk about today. So we have to think differently in our approach. And I think if you're listening to this right now, that's what you want. You want something different. You're tired of the same old, go to the doctor, get a medication. I mean, a dermatologist right now is simply going to do what I just told you. They really have very little understanding of what's happening. And it's not because, it's because that's the way they were taught, but it's because they're not doing a lot of investigating the rest of the body. They're really just looking, okay, this is a skin issue, this is what we give for it, and they're waiting for the next big thing to give for that symptom. Okay, so we have to think differently. That's that fireman carpenter principle that we talk about in the Wellness Way, is that your fire department puts out the fire, okay? So does your medical doctor. If you have an emergency situation, we call our emergency care system. Now, for most people, that's about 1% of the time in health. When you have the rest of your health, we don't want to continue to tear down the house every time we want have a symptom. We want to actually figure out the cause and then rebuild or restore the body. So everything you're going to hear me talk about in all these videos is how do you restore, how do you find what's breaking your body down, how do you remove that stressor, and then how do we restore your body back to its maximum potential, not just that it's functioning, right? It's functioning already, it's just seeing symptoms because that's how it's responding to adapt to its environment. Okay? Hope I'm not getting too wordy there. All right, so let's talk about leaky gut, because I want to talk about what's actually causing eczema, even psoriasis, other skin conditions as well. And it really stems back to stress. And these stressors affect our digestive system. So many of you have heard of that concept called leaky gut. And so let me just explain that to you so you understand what that actually means. So we got leaky gut here, and these right here are a cell lining, okay, a cell wall. So your digestive system lining is an epithelial lining. It's a very thin lining, actually. It's of one cell layer. And these cells should be are connected together and should be a small junction or very, very, very thin space, they call them tight junctions, to where only things that can get through there are the things your body needs to get through there. Okay, so communication happens from the bloodstream and the digestive system on what should come into the bloodstream. However, from stress, emotional stress, from physical stress, right? From chemical stress, like toxic chemicals coming into your bloodstream, a lot of different pathogens like bacteria and viral issues that didn't break down in the upper gut, in the upper stomach area from not having enough stomach acid, to medications can affect this, liver issues, right? Not detoxing the body properly. These all things can affect that. And what will happen is this cell lining will actually shrink and you'll get gaps in between these cells. Those gaps now allow foreign proteins that haven't been broken down yet from the acid in your stomach to now get into your bloodstream. So anytime, if you watch the immune response, Shifting Your Thinking, Shift Your Health last week, you learned that any protein in your bloodstream isn't a good thing. Any protein in your blood, your body's going to think as a foreign body and it wants to get rid of it, just like it would a virus or anything like that. So any protein that comes through here, now your body creates what's called an immune response. Okay, immunoglobulins, all those things that I talked about last time. Go back and watch the immune response video and you'll understand what I'm saying. But that ultimately will happen there. Okay, now this could be food particles that haven't been broken down properly from the upper GI system, and it'll get into the bloodstream. And when your body responds to those food particles or that protein, it creates what we call an allergy or an immune response, and it creates inflammation, which is another stressor on the body. So this is a type of stress on our system. Believe it or not, this kind of stress now can affect your adrenals. It can affect liver function. It can affect a lot of other health issues, a lot of other parts of your body as well. So that's your leaky gut concept. And what they've shown is that when this happens, it creates immune responses, and a lot of times these will show up in your skin. Okay, here in a little bit, I'm going to show you a study that shows you how this stress response actually affects the skin layer and everything else. But this is a picture of food allergies. And so like for me, I did my food allergies. This is mine. This one has about 28 different food allergies. This is somebody that had extreme eczema, and which is why I'm showing this one. But for me, I had 19 different food allergies. Growing up, I dealt with psoriasis most of my childhood. I mean, as long as I can remember, I had some sort of a steroid cream. It was all up and down my arm. It was in my head. As long as I could remember, I was dealing with psoriasis. I tried all the different creams. Eventually, I just got tired of doing those things and quit taking them, and so I just dealt with it. But then finally, as I started to learn how to eat better, I got chiropractic care. I started to learn more natural ways of detoxifying my body. My psoriasis really just went away on its own. Luckily for me, even with eating food allergies, I still didn't get flare-ups because I was doing all these other things right. But now you take the food allergies out and it takes it to a whole different level. So this patient right here had all these different food allergies, right? Look, she was baker's yeast. That's in any type of bread you can think of for the most part. Snapper. I mean, you got black pepper. That's almost in everything. You have oats, you have peanuts. She had all kinds of milk, cheese, let's see here, eggs, cow's milk, coffee, cane sugar. So pretty much anything she was eating was creating inflammation in her body. And so she had really, really bad eczema. When she took these food allergies out, that was the only change that was made. She took those food allergies out and the eczema starts to go away and it completely clears up. And that's pretty cool because food allergies actually can be the one thing for eczema. Now, does that mean if you got your food allergies that you're completely healthy? There's probably more to it than that, but just getting rid of the immune response that's leading to the skin problem, that could be one simple answer. Okay, so you can see instead of saying there's a skin problem, we're saying, okay, there's probably something else happening, and the most likely area that relates back to this is your digestive system. By taking this stressor out, which is a food allergy, you're now giving your body less inflammation, which allows it to respond better overall. Okay, and you can see the digestive system is super intricate. I'm not going to spend too much time on it. We did a whole webinar on it a few weeks ago, but you can see you got your salivary glands, the mouth, that's a part of it, how well it actually works its way through the esophagus, then it gets in the stomach, the level of stomach acid, if your stomach's not acidic enough, and this is actually really, really common. A lot of us have poor stomach acid from high stress, from taking medications, from poor diet. The stomach acid isn't high enough, then proteins don't get broken down properly. And proteins are in food, but proteins are also in viruses. Proteins are also in bacteria. And so it's actually a disinfectant to have a massive amount of acid. Well, those proteins now can get down through here. And they can also, if your gallbladder's not working very well, if your liver's not working very well, if your pancreas isn't working very well, then it'll cause health issues below, and those can now get into the bloodstream. Does that make sense? Hopefully that does. So this digestive system process is leaky gut, but there's more to it than that. There could be bacterial infections. There could be small intestinal bacterial overgrowth that can happen as well. And so testing this digestive system is really, really important because that will actually now, if someone has eczema, my very first step is food allergies, let's get those out. Second step is let's test your digestive system to see if there's an infection, to see if there's a bacterial, yeast, or a parasitic infection, to see what your IgA levels look like, which tells us a lot about how your immune response is happening if it's overactive. And there's so many things we test in that GI or that stool test that will tell us what's happening in here. And then if we can start to heal the gut up, we'll see amazing, cool stuff happen in terms of eczema. Okay, I won't talk too much about that part. So there's the wellness way approach, not just to GI, but eczema is what I just said. It's really finding the actual cause. This part is really important to understand, is our body is not systems. Okay, our body is not made up of a bunch of different systems. It is a system that works all together. So when we start addressing systems like the integumentary system, which is most of your skin, and all we do is look at this from a dermatologist standpoint, from a dermatologist standpoint, and all we're trying to do is heal the skin, we're going to get into a lot of health issues because we're trying to heal the skin and change that. You can take an anti-inflammatory drug and change skin issues. But the problem is now you're destroying your digestive system even more. You're probably going to cause some problems to the nervous system. It's going to affect your hormones. This isn't even a touchscreen. Why does it keep moving? It's going to affect your hormones. It's also going to affect blood flow from stress, right? Your body goes into this fight or flight response when there's stress. So every system is going to be affected, but the skin problem's gone. Or we can look at it and say, okay, we have a skin problem. What systems aren't lining up properly that's leading this to show the skin problem? That's weird. I'm not even pushing this. Okay. Anyways, so the first step we look at is the nervous system because that's a huge part of the fight or flight response. That sympathetic nervous system tells your body to, or parasympathetic, relaxed state tells your body to digest food. It tells your body to sleep. It tells your body, your immune system to respond strongly and be active. It literally allows your body to rest. I'm pushing this too much or something. However, if you're in a sympathetic nervous system response, that's your fight or flight mode, and that's going to tell your body to stop digesting food. It's going to tell your blood flow to increase to all the tissues and to all the muscles and brain. It's going to tell your immune response to slow down right now because it's not as important. Respiratory rate's going to go up. I don't know, maybe it's just a timing thing. Okay. But all those things are going to happen and you're going to be in a stress response, which will create inflammation in your body, and it can lead to things like eczema. So my point of telling you all that is to understanding health is the key to getting rid of eczema. Health definition isn't just nutrition and exercise and sleeping well. I know that's what we've been told for a very long time, and I talk about this every time I speak because I want to really set it straight that just eating good isn't the answer to your health. Just exercising isn't the answer to your health. Sleeping isn't the answer to your health. Although all these things are very important and will make a big difference, all these three things aren't going to prevent eczema because I've had plenty of patients come in that do all three of these very well and have eczema still or have other skin issues. So there's a different idea behind that. And to understand the definition of health, this is probably the most important thing I could ever teach you, is that health is a state of optimal physical, mental, and social well-being, and not merely the absence of disease. It's not the absence of a disease process. It's that your body is functioning and healing at 100%. So our job is to remove stress that might impede your body's ability to adapt as much as possible and then restore the system. This study is awesome. I just started reading about skin and stress and psychological stress and things like that today. And I came across this on PubMed, and this is from the Journal of Clinical Investigation. It says nervous system breakdown in the skin, stress, and epidermal barrier. This is a few pages long, but I wanted to just point out one pertinent part of it. And you can go read this on your own. It's kind of heady, but skin changes during systemic stress. Now remember, stress in your body is seen the same, whether it's physical, whether it's chemical, whether it's emotional. So we're talking about psychological stress here, but your body has the same responses with physical stress and chemical stress. It says the main function of the epidermis is to regulate epidermal permeability and to act as a physical, chemical, and antimicrobial defense system via the actions of the outermost layer of your epidermis, the stratum corneum. This is the stuff you see on top. The natural antimicrobial defense of the skin also involve elements of the innate immune response. If you remember last Thursday, we talked about what is your innate immune response. Well, your skin is a huge part of your innate immune response. The acidity of your skin is huge in terms of keeping microbials out of your body. Okay. The natural antimicrobial defenses of the skin also involve elements of the innate immune response, such as the production of antimicrobial peptides, things that break down microbials, lipids, toll-like receptors, pro-inflammatory cytokines, and chemokines during periods of psychological stress. This is the part I want you guys to grasp. During periods of psychological stress, the cutaneous homeostatic permeability barrier is disturbed, as is the integrity and protective function of the stratum corneum. Furthermore, a large number of skin diseases, including atopic dermatitis and psoriasis, appear to be precipitated or exacerbated by psychological stress. Now you say, well, I have a baby that has eczema. How do they have psychological stress? Guys, stress, they're talking about psychological stress in this study because that's what they focused on, but stress is the same, whether it's physical, whether it's chemical, whether it's psychological. And so that your child may not have extreme psychological stress, but what I can promise you is there's most definitely a chemical stress or some sort of physical stress. The reason we actually, when a baby is born, we check their spine and nervous system and make sure there's full range of motion and movement in the spine is because if we don't, then there's a constant physical stress on the body. So if a baby has eczema, number one, let's start getting them chiropractic here. Number two, let's look at the rest of the body. Let's look at the digestive system and see have chemical stressors or poor probiotic health or poor things like that, which would in some way be considered that chemical stress. Is that what's causing the gut issue, which would be causing the eczema? So you see how this is more just an investigation? So I can't stand up here and lay broad statements that everybody with eczema has this problem, like a gut issue or this specific gut issue, because everybody is an individual, okay? But what I can tell you is these are the areas that you need to start to investigate for you or your child to see if that's why you have eczema, because we know it does relate back to stress. Right? That's a very important thing to look at. So the first area you want to look at is trauma. What traumas have been there? If the baby's been born, they've been through a trauma. If it's been a C-section, it's been an extreme trauma. If it's a vacuum that they use or forceps, that's an extreme trauma. Even a natural birth can be traumatic for a baby. Okay? So first trauma is birth. Second, are you someone that's on a computer all the time? Are you hands down like this, right? On a cell phone, like text neck? Kids with backpacks, car accidents, sports injuries, all these daily life activities that have actually creating physical stress. Now, I'll just tell you this, like for me, when I think of physical stress, I think, well, we've always had this. Now, granted, we sit way more than we've ever had before, and that is the biggest physical stress. But shouldn't our body just be able to handle physical stress? Why do we need a chiropractor to help with physical stress? And the reason is because we have more stressors than we've ever had before. We don't just have physical stress, we have more chemical stressors than before. We live such a sedentary lifestyle that the chiropractic portion of health care is so huge because your spine, 90% of the stimulation to your brain comes from the movement of your spine. If these are part of your lifestyle, sitting at computers, car accidents, sports injuries, having a traumatic birth at all, then your spine is going to subluxate. And what that means is it locks up. It's not moving in certain areas. It's a segmental dysfunction of the spine, which creates stress. That in and of itself can cause a digestive issue, much less all the other chemicals and things like that that go with it. So number one, we look at the physical stress. Okay, and then I won't talk about the spine, but the x-ray part of it. That's also the x-ray part. The second thing we also have to look at is toxic stress. What kind of chemicals are in your environment and have built up in your body? Right? So we look at toxins. I'm going to point this one out right here. This is Propel, and a lot of these flavored waters people think are healthy for them. But I want you to realize is that they have things like sucralose and aspartame. Sucralose and aspartame will destroy the microbial lining of your gut. Okay? And if you destroy your microbial lining of your gut, you lead to a leaky gut. Chemicals from beauty products. You have tons of different chemicals in these beauty products. I can't even go through a list of them right now, but you want to go with a natural beauty product. That affects digestion and affects eczema. Same thing with deodorants with a lot of heavy metals and aluminum. Obvious environmental toxins, these are a little bit harder to control, and that's why we go through detoxing regularly because they're always in our environment. Heavy metals in our teeth, a lot of the fluoride, chlorine, bromelain, which is in a lot of our foods, is one of the biggest things that will cause thyroid issues because it absorbs in your thyroid. It acts as iodine. And the reason I'm going through all these is because they all have an impact on your skin. Okay, toxic buildup, you'll see it come out on your skin as a sign, a warning sign that that's happening in your body. Okay, The other one that I'm not talking about is the emotional stresses, which are just how you're responding to your environment, the traumatic things you've had in your life. Some of these are a part of life, but at the same time, as you take these physical, chemical, and emotional stress, it builds up and it affects digestion, it affects your immune response, it affects all these things, and eczema is one of your warning signs of that, okay? So hopefully you guys are seeing that at this point, just from me going through this in a very short period of time, and I only went through a couple of things. I really had like a stack of stuff that I could go through with you in terms of research on eczema, on psoriasis, on acne. Believe it or not, these are all kind of falling into the same realm of how that actually is not a skin issue. It's an immune issue. It's a hormone issue. It's a digestive issue because all these systems work together. Foods to avoid. Okay, so I wanted to put together some active things you could do without having to, if you haven't had any food allergy testing, if you hadn't had a stool test, if you haven't done any testing for this, but you have eczema and you want to do something when you get off this video right now, here's what you do. Number one, avoid these foods. These are some of the most common food allergies, number one. And two, even if you're not allergic to the protein in them, they're highly processed, genetically modified, and are going to create tons of gut issues and inflammation. Remove dairy. It's not a necessary part of our life. I'm not even going to talk about why. We can talk about hormones. We can talk about antibiotic use. We can talk about how poorly fed most cows are. We can talk about the pasteurization process and how it kills all the enzymes. I guess we are talking about it all. Wheat. Take wheat out of your diet. Wheat is a genetically modified plant. Most of the wheat in our world today is genetically modified, and it's going to have a negative impact on your digestive system, and it turns to sugar when it gets in your body. Plus, most of the wheat products you're eating have tons of preservatives in them as well. Corn and soy. Corn is not a vegetable, it is a grain. And so grains are things I like to remove because they create lots of inflammation. They're hard to digest and they turn to sugar. Corn and soy are also highly genetically modified foods, okay? And soy will create a lot of xenoestrogens, which creates hormone problems. Processed foods, okay? Processed foods, obviously that's a clear one. Sugar, not all sugars are created equal, but removing as much sugar as possible, especially refined sugar, is going to have a huge impact. If you're someone that does have eczema, you're probably dealing with a digestive issue. To be honest, you're probably dealing with some liver backup as well, and the liver's not processing things properly. So I would also say you probably need to remove fructose. We talked about this on Monday, but fructose is broken down 100% in your liver. So if you're eating a lot of fruit, that actually can be hard on digestion and it can be hard on the liver. Fruit at the same time has a lot of good stuff for probiotic health. So fruit is fine as long as you're eating low fructose fruits, your berries, apricots. Just go and Google fructose in fruits and see, like, there's like a scale you can look at, a chart you can look at to see how much fructose is in the fruit that you're eating. Food allergies. Get tested and find out what food allergies you have. And I'm not talking about you eat something, your whole body swells up and you need an EpiPen. I'm talking about internal chronic immune responses that happen from certain foods in our body because of a leaky gut. Hydrogenated, partially hydrogenated, and refined oils. These are fairly self-explanatory. Your canola oils, vegetable oils, safflower oils, cottonseed oils, and the list goes on. But hydrogenated, partially hydrogenated, or refined oils, even coconut oil that's refined, I recommend staying away from. And then finally, genetically modified foods. This is a quick list. Removing these right here, that might seem like a big list because it's most of what most America eats. But the reason most of America is sick, because this is what most of America, we call it the sad American diet, right? It's very sad. Getting this out of your diet is going to be a huge first step, not only for eczema, but you and your family's entire health. Now, I've had patients that come in and say, I'm doing all those things. Well, if we don't know your food allergies, then no, you're not. But they're doing all these other things. Well, maybe you are stemming from food allergies, but you have a bacterial infection. That's why testing is so important, and it has to be individualized. But for a good majority of people, just this right here will change it. Hey, when you start changing these things and you start taking, like I'm going to talk about supplements here in a second. We'll kind of dive into that here in a second. But different supplements, things like liver support, a lot of times it'll actually create some skin issues because your body, now liver's starting to wake up and it's detoxifying, okay? But those skin issues won't last forever. Foods to start eating to improve digestion. Fermented foods and drinks, Okay, apples like kombuchas and things like that, kimchis, apple cider vinegar. I recommend apple cider vinegar all the time because it helps stomach acid, and most people have stomach acid issues. Do a tablespoon of apple cider vinegar and water in the morning and in the evening, and that'll help at least some improve stomach acid. Aloe vera juice. This is amazing for the gut lining because it's calming. Just like so think about this, if you have a leaky gut, it means it's inflamed, okay? If you get a sunburn, skin gets inflamed, what do you want to put on it? One of the most common recommendations is use aloe vera because it's soothing. It helps relieve that inflammatory response. It does the same thing for your digestive system. Okay, now it needs to be organic, a glass bottle, not a bunch of additives to it, but once you want to be high quality aloe vera juice. Steamed veggies rather than raw, and that allows it to be easier to break down in your body. I know we've talked about raw veggies being the best thing in the world for you. I actually like them steamed for about 3 to 5 minutes because that will allow the nutrient value to go up, but it also makes it easier for your stomach to break it down. You're helping out the stomach acid. Foods low in lectin. Lectin is a natural pesticide which within many of our vegetables. Okay, most all of our vegetables have them. Some are harder to break down. Your nightshade vegetables are going to be harder. There's a really cool diet called the plant paradox diet, and he walks you through a lot of the foods that are harder to break down because of lectin. So plant paradox diet, I don't recommend everybody following that, but some of those foods high in lectin, like peppers and tomatoes, things like that, are good to get out of your diet. Chamomile. Chamomile is very soothing for the digestive system. You can get an actual herb tincture of it and take that with water. Sauerkraut is a really good one. This one's high in probiotics. It's high in lactobacillus, really good for helping your body digest food. And the ones I put down here, this is kind of interesting, right? Breast milk. We've actually had babies who were unable to breastfeed, or the mom was unable to produce. And a year or two ago, we had eczema, and my wife, probably actually 3 years ago, Eleanor was born. She took the milk because we weren't using it for Eleanor because she was breastfeeding, and she took the milk she had pumped, gave it away to one of our patients, and it helped tremendously with that baby's eczema because there's high levels of IgA, just really good bacteria in breast milk. Bone broth also helps increase your immune response in the gut with IgA levels. So drinking bone broth can be a very good addition when you're making an eating plan to help with eczema. Okay, so supplements. Now I've said this before, I'm not a big fan of a bunch of supplements you should take, mostly because people are individualized, but there are some things that I think across the board, I think anybody could do, and they're going to be beneficial for you. Number one is desiccated liver. You want a grass-fed, free-range, organically raised cow liver, and you can eat that, or you can take a supplement, which is in a desiccated liver form. It's a dehydrated liver. And so you take that, and I was saying this earlier, but I've had patients who actually took that and they started getting eczema. And you think, well, that seems like we're going in the wrong direction. But no, it's actually because their liver and chemical buildup was so much that your liver wasn't working properly. When we start to support the liver, we'll actually see sometimes skin issues increase. So if you start taking desiccated liver and eczema gets a little bit worse at first, that's okay. It'll shift around once your liver gets things under control. Probiotics. You want a 20 billion plus probiotic from a good source to make sure that you're getting the good bacteria in your gut, because that's part of digestion and breaking down foods. Digestive enzymes. These are really good to help break down your food. If you're dealing with a stomach acid issue, or better yet, if you're dealing with eczema, you're probably dealing with a stomach acid issue. So we want to take digestive enzymes to help out the stomach acid every time you eat. HCl, hydrochloric acid, is your stomach acid, okay? So you can even get to that level where you take HCl to help increase stomach acid. Zeolite. Now this is a new one. I don't talk about this one much, but this is a really cool product that we use to help detoxify the body. It really binds amazing to heavy metals. I was almost worried about putting that on there because individualized, I kind of want to know what you're, but it's something you could try to help detoxify your system and get chemicals out. And then finally, astragalus. I talk about astragalus a lot lately. Astragalus is amazing for shortening telomere length. It's amazing for helping your immune response. It's shown to actually help your innate and adaptive immune response, which is you're dealing with an immune issue if you have eczema or other skin issues. Okay? To get lasting results, okay, as we end up here with this getting lasting results, I don't want you following a diet for 30 days. I don't want a detox program. I don't want you to take a few supplements for a month. I want you to actually not you're no longer in a therapeutic mode, but you're in a true wellness care, okay? And this is our endpoint. We want to be in true wellness, which is we're moving health, not trying to get rid of symptoms all the time. And most people spend their whole life in this getting rid of symptoms mode. So number one, first thing you have to do in order to get good results, right? This is the best approach you can take, is number one, find out the stressors. Start to evaluate your life and lifestyle and see what emotional stress is unnecessary, or what's your viewpoint on life to tell how your body's handling that emotional stress. Look at the physical stresses. Are you at a computer all day? Are you like this all day long, right? Are you on text messaging all? Do you sleep on your stomach? Are you sleeping awkwardly? Have you had a car accident, a sports injury? Are you very overweight and inflamed? That's a physical stress on your body. Chemical stressors could be it as well. So the first step, removing those chemical stuff, test. Evaluate. Testing doesn't actually have to be blood work. It doesn't have to be a urinalysis or a stool test. First test is test your life. Look at around your environment and what it looks like. What are you doing on a daily basis, physically, chemically, and emotionally, that might be stressing your body, okay? Second is doing an actual test of your stool. Second would be the food allergy test. I like that one because we can immediately remove stressors. Third is the the stool test, okay? So food allergy test, stool test, I think are essential for someone with eczema or any skin issue after looking at the lifestyle stressors. Number two is now we start to remove stressors and reduce inflammation. The first process of care for anyone in our office is reducing the amount of stress in their environment, increasing their body's ability to handle stress, and reducing inflammation in terms of a constant immune response, because if your body's inflamed, you're in a chronic immune response, which is not good for you long term. Number three, restore the body. Once we've reduced inflammation, once we've reduced stress and increased strength in the body, now we want to restore the body back to its regular functioning everyday life. Now, once we've done that, now why don't we detox? Because you do still have chemicals typically that are holding up in your body, but now your body's in a strong state. So now let's go through a proper detox program, not some box with supplements, an actual eating plan and a supportive liver protocol that will help your body remove more toxins. And now we go into wellness. And wellness is eat clean, exercise, move, do your 5 essentials that we always talk about: diet, rest, exercise, proper alignment of your body, mindset. And your health isn't a destination. So wellness isn't necessarily a destination. It's a continuum. It's something you're constantly moving towards to get better. But if you're stuck up here in therapeutic mode all the time with pain or with symptoms or with actual disease process, you can't do wellness yet, because we have to actually figure out what's causing the symptom, okay? Not treat the symptom, right? Patients want to come in on blood pressure meds, all these different medications, they want care. You're not at wellness care if you're on a medication. That's impossible to have wellness and take a drug. Just listen to what I just said there. You can't have wellness and take a drug. That doesn't work that way, because you're blocking your body's ability to adapt, which is the definition of wellness. Does that make sense, guys? So I don't mean to be direct to you there, but I want to get that through. Sometimes we don't get that it's like, wow, I don't want to not take this medication. Well, that's fine, but you're not going to get wellness if that's where you want to be. We have to remove these things from our environment as much as we possibly can. Finally, to review, the cause of stress is trauma, toxins, and thoughts. Evaluate your environment, number one. Okay? Just some examples of the testing. And ultimately, there's 2 approaches to health, guys. It's the kind of normal medical model that we're following, which has led to and will continue to lead to disease, because we're covering up symptoms and blocking the body's ability to respond to its environment. And that's how we're getting rid of symptoms. Or we can ignore the symptoms and start focusing on health, which is your body's functioning and healing at 100%, that functioning to 100%, and then continue it on the continuum, which is what health actually is in wellness. So guys, hey, hopefully that was helpful for you. Hopefully you got a lot out of that. A kind of final approach here is I want to give you guys a way to connect with us. I get messages all the time. Sometimes it's hard to respond to the messages. So here's the best way to connect if you want help with your health, whether it's through our clinic, whether it's to refer you to somebody in a different area. Either way is fine with us. Number one, though, join Queen City Health Center. You're group. We're trying to get as many people on that as possible, get some good conversation going on there, and have kind of like a VIP experience on that area. So just simply go on, search Queen City Health Center, Your Health Now on Facebook, and you can get connected there. Every Tuesday and Thursday, 12 p.m., we're doing this video. We're doing Shift Your Thinking, Shift Your Health. Thursday is going to be the long one where you really dive in. And if you can hang through that hour, then you are going to be a health expert over time. Monday is going to be our short 5-10 minute one. Just a quick tip. Podcast. Hey guys, check out our podcast. Me and a couple of my buddies started a podcast called Owning Your Health. It's really cool. We've had a good time with it, but it's all about teaching you to become your own health expert. Finally, if you want individualized help for you, 15-minute phone consult with us, just simply go to queencityhealthcenter.com and ask to have a free phone consult, or you can come into our clinic if you want to meet us directly. Cool? So I hope you got a lot out of that. And yeah, thanks so much, guys. Like this, love it, and share it. Again, the true answer to health is by shifting your thinking. Change the way we're viewing. If we keep doing what everyone else is doing, that is the definition of insanity. You're going to get what everyone else is getting. The reason people are scared right now of viruses is because they think wrong. They think how the medical community has taught them to think. And I'm being direct because it's the truth, and sometimes you need a lightning bolt shot right at you. The truth is you got to change the way you think, okay? So thanks so much for watching, guys. Like this, love it, and share it. I couldn't end without a little bit of directness. But yeah, share this for people. They need to hear, understand what health actually is, and we'll talk to you next time.